In the last 24-hour cycle, 4,519 new coronavirus infections have been recorded in South Africa. 70 more people have succumbed to COVID-19 related complications. This brings the national death toll to over 56,000. Active cases have increased to over 48,000. President Cyril Ramaphosa says almost 1 million South Africans have been vaccinated since the start of the first phase of the country's COVID-19 vaccination rollout. To talk to us more on this is co-convenor of the Progressive Health Forum, Dr. Aslam Dasoo. Dr. Dasoo, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening. Good to be with you.
What are your thoughts on the President's address? Will the measures that he announced make any improvement?
Well, I think the main takeaways from the President's address, there are two major messages. One is a message to the whole country that we have to survive this third wave. We have to get through it as best we can. And the second is to get vaccinated as soon as possible. And now, I think that's exactly the right message. However, when one unpacks it, one realizes that this is a difficult ask at this time, given that the trajectory of this imminent third wave is quite steep at the moment. Infections are really rampant, especially in Gauteng. And surviving this third wave means not getting sick. And I think he was clear on that, to stay responsible, to use the measures that are well known to prevent transmission. And of course, not getting sick means not burdening the health system, which is already at this stage of this third wave facing severe pressure. And I think if we are serious about doing this as a country, we have to accept that we won't have sufficient vaccination to attenuate this third wave. So the solution really lies in our hands. I noted that he'd announced restrictions on gatherings. This is probably the most important element of attenuating this wave, because it's out of gatherings that these exponential spreads occur, called super spreading events. So we absolutely have to prohibit those. Bringing them down to 100 indoors, and with all its caveats, is still very high. So that still remains a concern. But I guess within the wisdom of the Command Council and the President's view, they were only able to restrict gatherings to that number.
And having said that, but the President made no mention of the sale and the consumption of alcohol, yet it is said to be one of the triggers of the mass spreading of the virus. Could it have been an oversight on the part of the advisory committee, or was a consideration made about the value of alcohol to the country's economy?
Yes, I think that's quite correct. I think the industry was battered so much in previous lockdowns, and the knock-on effect it had on the economy was so severe that the government was correct to act with circumspection. That being said, we do know that alcohol consumption increases the trauma load at our hospitals. And I wouldn't have been surprised, but he didn't make the announcement, if he had said that we'd restrict sales of alcohol over Fridays and the weekends. But as it stands, things are as they have been. And one is hopeful that the health sector will be able to cope.
Now, there's growing concern, Dr. Dasoo, about whether the variant first detected in the United Kingdom could be causing more infections in children. Should we be worried here in South Africa about the safety of our children?
I think it's inevitable that children are going to be infected. And I think the emergence of variants may accelerate that, which is what you're referring to. So, of course, surveillance of that issue here in South Africa is very important. The UK variant is present. I'm not sure to what extent, as are the Indian variants and others. But our dominant variant is the one first detected in South Africa that led, as you know, to the second wave. And that is pretty much what is driving transmission right now, in our view. So I think we must accept that we are probably going to see a trajectory similar to the second wave. One is hopeful that previous infections and a diligent attention to non-pharmaceutical interventions will help that wave not exceed the dramatic wave we saw in December, in January. So I think we are now at a place where we have to be very focused on getting through this wave. We are on the back foot. Our vaccine program is very late, and he was gracious enough to admit to the teething problems of the new state rollout of vaccinations, as was inevitable. But he struck a hopeful note that there will be sufficient supply, which is the really main constrictor to a successful vaccination program. So it really remains to be seen. He did mention the Johnson & Johnson vaccine being sequestered and not available because of the problems in its production. Well, it is important to note that the FDA has prohibited its use, but that should not prohibit our own regulators. If they are satisfied that the batches produced here are safe and efficacious, we should proceed with vaccination. We actually don't have the luxury of the FDA. And if the vaccine is safe and fine, we should distribute. We should also seriously think about widening the scope of acquisition of vaccines. The government right now is the sole procurer, and it is laboring under that. COVAX is not delivering. The numbers of vaccine coming in are quite low. And we should use the best officers of our country, the business sectors who are capable and who do have ability to acquire vaccine, should bring it in and make it part of the national pool of vaccination so that we get as many people as possible vaccinated in the shortest possible time. The president, also said so.
Yeah, and I want us to delve deeper into the vaccination drive that is currently underway here in South Africa and about the comments that you made earlier on this year with regards to the procurement of these vaccines. And I understand that the variant has a mutation that sort of makes it easier for the virus to latch onto our cells and then cause an infection, which could be why more kids seem to be getting the disease. And I guess we should revisit the debate that was sparked in the early days of the virus, whether children have been largely spared during the pandemic or not, mainly because the virus has a harder time binding to receptors in their cells compared to those of adults.
Look, I think the science still remains pretty clear that the risk to children is very, very low, and that the public health and epidemiological approach that we've taken is still correct. The most at risk are the over 60s, or rather, shall we say, the elderly. So age is your major factor affecting the possibility of hospitalization and or death. And then, of course, comorbidities. Now, as you move to the younger generations, the risk decreases, and it does with children as well. It doesn't mean that children won't get infected. And there is a big debate now globally about countries that are starting to vaccinate their children, while other countries in the world are really suffering serious shortages of vaccines to vaccinate their older adult population who are more at risk. And I think this is probably a function of the unequal distribution of vaccines, and it's a real problem. But at this stage, we have to look out now for South Africa and its surrounding region and attenuate the pandemic in this area as best we can. We should get in as much vaccine as possible through whatever sources we can get them from and vaccinate at scale. Business has been working very closely with the government, we know. And that's been a very fruitful effort, and they are going to be part of this rollout. But I think they need to step up and be even more useful by being organized in a way that can make it easy for them to acquire vaccines. The mining industry has already put up its hand in that regard, and it's something we should encourage. Because there's no other option for us to get through the emergency phase of the pandemic at this stage. Our capabilities have been shown up to be not up to scratch, both in terms of our acquisition of vaccine and the pace of rolling out. And it is what it is now, and there must be a reckoning for this at the appropriate time. But right now, we need vaccines, we need to get them into arms, and we need to protect people. This is not a war, it's about protecting our people from a really virulent pathogen.
Now, early this year, you said that government dropped the ball in procuring vaccines. So what's your impression of how the government is now rolling out the mass vaccination drive?
Look, they've made strides since then. It must be admitted they have now secured, according to them, millions of doses of both the Johnson & Johnson and the Pfizer vaccine. But, you know, this pandemic throws up curveballs all the time. And if we are going to rely on very narrow channels of acquisition, things can go awry very quickly, as we noticed with the Johnson & Johnson vaccine, even though it's being manufactured right here in South Africa by Aspen Pharmacare. It's now on hold. That was not expected. So, and the president also alluded to that fact. You know, it doesn't take us away from the fact that we have not, covered ourselves in glory as far as vaccinations are concerned and acquiring vaccines. We have one of the lowest rate of vaccinations in the world and one of the highest rates of death from COVID in the world. Now, that is a correlation you never want to see. And I think we need to take a step back and see what else we can do to acquire vaccines for the country.
Should we start a conversation about the efficacy and the quality of the brand of vaccines? Because President Ramaphosa also mentioned the Pfizer vaccine, the Johnson & Johnson vaccine, and the Sinopharm vaccine from China. Should we be, worried about which brand of vaccine that we should be focusing on?
No, certainly not. I think the vaccines that have been approved for global use, that have been approved by the WHO, are all safe and efficacious. Our scientific fraternity here will concur with that. All of these vaccines are effective. They may be effective to differing degrees in different settings. That is true. For example, the AstraZeneca vaccine here showed a low efficacy in preventing mild and moderate disease. In the UK, half of the population has been vaccinated with the AstraZeneca vaccine, and it is doing just fine. So it's a question of which is the most efficacious against the variant circulating right now. And those are fairly easy decisions to make once you know and acquire the appropriate vaccines. I don't think, though, it is a question of a comparison about either their safety or their overall efficacy. They will all prevent serious disease, hospitalization, and death. And that is a focus right now with this first generation of vaccines. We are not going to get to herd immunity anytime soon. That will probably come when a second generation of vaccines are developed to meet the emerging variants and to suppress the virus on a global scale. That will also require the mass production of vaccine beyond what we have right now, and the discussions of the WTO are very relevant to that. And I think if we are serious about preventing serious illness, we should encourage everyone to obtain a vaccination wherever they can get it. And the sites are opening up. There are only 400 at the moment, which is hopelessly inadequate. We need thousands of sites and an ongoing supply of vaccine to get millions of South Africans vaccinated in the shortest possible time.
All right, Dr. Dasoo, great chatting to you. Thank you so much for sharing your thoughts with us this evening.
You're very welcome.